Hey, GLP-1 plus sides community. Before we jump into the podcast, please take the time to leave us a 5-star review on whatever audio platform you're listening to the podcast on. Share your story and how the podcast has helped you. This will help us get referred up in the audio platform so that we can reach more people that need our help, our support, and guidance from our doctors. Help us get loud and change things.
Are you interested in understanding GLP-1 medications like Ozempic, Wegovy, or Mounjaro? Then join us on the Plus Sides, Cracking the Obesity Code, the groundbreaking podcast helping people change their lives one episode at a time. The Plus Sides podcast is a disruptor. We're breaking down barriers, smashing stereotypes, and sharing inspiring stories that'll leave you feeling informed and empowered. Join us every week to learn from doctors who are specialists around GLP-1 medications like Ozempic, Wegovy, or Mounjaro. They'll provide you with science and facts to validate these incredible stories. But that's not all. We'll also bring you the voices of the GLP-1 Mounjaro TikTok community, real people who face the challenges of obesity-related diseases and disorders and discovered the incredible plus sides of GLP-1 medications. Our episodes are filled with heartwarming stories, laughter, and moments of triumph. You'll connect with our amazing community members who are reclaiming their health and experiencing their fullest lives. Are you ready to embark on a journey of discovery and empowerment? Tune in to the Plus Sides, Cracking the Obesity Code, and together we'll change the narrative around obesity and end the stigma. Subscribe now on YouTube or your favorite podcast platform and join our incredible community. Let's celebrate the plus sides of life together because every story deserves to be heard. Every life deserves to shine, and everyone deserves access to expert knowledge and medication. The Plus Sides Podcast. You're not alone. It's not your fault.
Hey everyone, before we dive in, I really want to share something personal with you. About, I want to say like 8 to 10 months ago, after losing 100 pounds on GLP-1s and keeping it off for a long time, I started regaining out of nowhere, and I was terrified. But I also started having hot flashes and bouts of crying and snacky cravings and waking up at 3 a.m. unable to go back to sleep. It turns out I was in perimenopause. So I started hormone replacement therapy, which is also called HRT, through a telehealth called Winona that specializes in this. And it changed everything. And now I'm sleeping better and my hot flashes are all but gone, thank God. And I feel like myself again. And it turns out that you can actually start perimenopause as early as 35. And well, I'm 46 and she's here. HRT has really come a long way and there's just no need to suffer anymore. So if you're like this and you're in the same boat, you can check out buywinona.com and you can use the link in our Linktree to save some money.
Want the fastest working GLP-1? For half the price, Ro now offers FDA-approved weight loss injections cheaper. With results you can see faster. Lose 15% of your weight with the formula from Eli Lilly that hits not one, but 2 hormones to curb hunger and nausea. Weight loss faster, confidence higher, price cheaper. See if you qualify at ro.co/TV.
Are you ready to transform your approach to weight management? Introducing Mochi Health, a revolutionary telehealth platform connecting you with board-certified doctors and dietitians from the comfort of your home. Their holistic approach includes personalized nutrition plans and FDA-approved GLP-1 medications like Ozempic, delivered right to your door. At Mochi Health, they believe in affordable, accessible care for everyone, regardless of insurance coverage. No more blame or shame, just support from real doctors and dietitians who listen. Visit Join Mochi today to start your journey to a healthier you. Use code PLUSSIDES to receive $40 off your first consultation. That's joinmochi.com with code PLUSSIDES. Mochi Health, where your well-being comes first.
So when people want to rush, I tell them, patience. We have to go slow, right? And a lot of them has to be with goal setting, right? So yes. I tell people, it's very commonly said, you have to walk 10,000 steps a day. Well, some individuals aren't even walking 1,000 steps a day. Right now, a lot of people are working from home. I mean, some people live in 1-bedroom apartments, some people live in studios. It's hard to walk around, get that much movement in. And some individuals might say that's a big barrier for me, right? And I believe that giving someone an attainable goal and then kind of inching a little bit further from there is going to give them better long-term outcomes, probably, because one, you're going to feel good about having achieved a smaller goal, but then you're going to be motivated to achieve a little bit more, right? And a little bit more and a little bit more. And I think that goes a long way, right? So I think sometimes pacing yourself is really important. I think being kind to yourself, right? So just saying, how you're saying, like, I'm just going to keep track of these two things and then see where I can go from there, right? So maybe saying, okay, I was only walking 1,000 steps. Let's see if I can do 1,500.
Yeah.
Right. So be kind to yourself, be patient. I've had patients come in who say, I'm drinking 3 liters of Coke a day, Dr. J. I don't know what to do. And I'm like, okay, you think you can cut down to 2.5?
Yeah.
Right. Something attainable. I'm not going to say, stop, don't drink it. Right. Because that might be completely unattainable to somebody. Right. So you might have to come down slowly or ramp up slowly. Right. Yeah. But it's about building, it's about unlearning, relearning, building habit changes. Right. And these things take time. Yeah. They take time. Right. And they take patience and they take a lot of support. And a lot of regular follow-up and guidance. And that can be support of your community, your friends, your family, your physicians, whoever that is, your healthcare providers, anybody on your team, right? And I think that's really important, to surround yourself with support, because it can be hard. Yes. You can just be like, you know what, this is so hard. I just want to go back to my old way. Sometimes that happens, right? And
yes, for sure.
And I appreciate my patients that come and tell me about their challenges. And I ask them often, I said, what's the challenge, this week? What was the most challenging part of this week? What was the most rewarding part of this week, right? How happy were you with your progress? These are things that you should kind of take note of, and you should also let people know, because it's okay to ask for help. Yeah. It really is, right? Yeah. So I think sometimes people are also afraid to say what's not working well. And maybe they want to give the cookie cutter answer and say everything's fine, right? It's about delving a little bit deeper, being honest, right? And sharing that information if you've developed that relationship.
Yeah. Yeah. That's awesome. I think, in general, there are a lot of people that will come like to the lives, especially, and they're like, how do I ask my doctor? How do I start that conversation? And I always say, I wish I had gone to an endocrinologist first or an obesity specialist first. I feel like, but I also don't think that that's realistic, because there's not enough of you and it takes a long time to get an appointment. So if someone's going to go to their general doctor, the practitioner, PCP, and we know that it's a difficult conversation to have, right? And we know that a lot of doctors, because of PAs and the issues around getting these medicines approved and shortages and all the things, a lot of doctors don't want to prescribe them. Yeah. So I would love if you, knowing that you're, working in that area, right? Like, how can I tell my community when they say, do you have advice in this? How can I tell them to be intentional about it, right? Like, and what to ask or how to handle, how if they need to go prepared, like all of those things, so that they can feel comfortable and feel like they have everything they need to be able to advocate for their health.
Yeah. I think once you decide, then it's time to take steps forward from there, right? So the first step is you acknowledging or deciding, like, yes, it's time for me to go ahead and seek care for this aspect of my health, right? And that could be weight management. If that's the case, it's really important to do some research about your doctor, right? Or the healthcare provider you're going to seek, right? What is their training? What did they train in, right? And are they familiar with what you're looking for, right? So are they someone, and they may not, for example, your general practitioner maybe didn't do endocrinology fellowship, right? Otherwise, they're endocrinologist. Maybe they're a general internal medicine doctor, but maybe they are very well versed in prescribing over the years and have become very familiar and comfortable with these medications. That's really important, right? So doing a little bit of research about what your doctor's interests are, what they actually do on a daily basis, is really important. Sometimes that's hard information to find, but sometimes it's actually not so hard to find when you have a good community. Maybe you have good reviews, maybe you have portals that tell individuals like, hey, this doctor is actually a champion of women's health, or this doctor is a champion of X, Y, and Z, right? This medical doctor is an advocate for mental health, right? So that may be something you might be able to find even on something as simple as voluntary information that the doctors provided themselves, maybe in a profile that they've posted, right? Or a website. So that's one piece of information. So knowing if they have the credentials to be there. 2, seeing what their interests are. 3, I would say the moment you're ready, just go and book an appointment, because that appointment might take a long time to come. All right. Yeah. When trying to get an endocrinologist or obesity medicine specialist, especially I would say obesity medicine, there's only a few thousand doctors that are certified in the United States. It's more people are interested, more people are trying to get certified, but far and few, right? And even though there are more endocrinologists, we're very less compared to the demand that's out there. So I think as doctors who are trained, we're also trying to help train other healthcare providers in this, because we know that we can't reach everyone, right? Yeah. So we're trying to make other doctors also comfortable with these medications through education. And we also work a lot with other specialists. Like I work with my fellow, primary care doctors. I work with neurologists. I work with my GI doctors. I work with surgeons, right? I work with so many people. So it's really important to go ahead and book that appointment. And then, maybe even going as far as nitty gritty, trying to get on the wait list.
Yeah.
Right? Calling, looking for that cancellation appointment. I have cancellations every day, even though I might be booked out for 4 months, right?
Ooh,
So yeah. So sometimes it's about being active and trying to really reach that goal. The other thing is, you're totally right that a lot of doctors are short-staffed, right? And prior authorizations can be a big component of these medications, right? That, unfortunately, doctors will have to try to do their best. But what I can say, as far as, the medical committee, we're also educating doctors that, hey, prior authorizations, this is the way to tackle them, right?
Yeah.
What are the medical conditions the person has? Why do they qualify? What are some reasons they can't be on other, weight management agents or anti-obesity medications, right? So this is information your doctor might have to gather. But what you can do to help, you can give your insurance a call.
Yep.
And you can say, do you cover anti-obesity medications, right? And which ones do you cover? And you can bring that information to your doctor and say, I already did my homework, right? Mm-hmm. And I found out that X, Y, and Z are covered. Now, sometimes there's a very good reason I said anti-obesity medications, because sometimes insurances will tell patients, hey, Ozempic's covered, right? Great. And they won't give you the fine print that it's only if it's indicated for type 2 diabetes, right? That's an official FDA indication, right? So patients may mistakenly come in and say, but I was told my insurance covered Ozempic or Mounjaro. True. But if you have a diagnosis of type 2 diabetes, right? Yes. So that's why you should ask your insurance about anti-obesity medications, right? So that's another thing that you can do in the interim to really help set yourself up for success.
Do you feel like that language exists when you call your insurance company of anti-obesity, or are they going to call them weight loss meds? Quick pause here. I've had moments on my GLP-1 journey where insurance changes or rising costs force me to look for a new provider. And honestly, that process can feel very overwhelming. But that's why the Plus Sides podcast is partnered with GLP Winner to give our subscribers a resource to help them make that decision easier. GLP Winner is a comparison platform that lets you explore telehealth providers in all 50 states, whether you're looking for brand name medications or compounded options. You can see pricing up front, read reviews, and get a clear picture of which provider might align best with your needs. Check it out today at glpwinner.com/plussides. That's glpwinner.com/plussides. Don't forget the Z. Let me tell you a quick story. I was telling Kat how I was regaining weight after my 100-pound loss using GLP-1 medications, and I was having snacky cravings and waking up at 3 a.m., and I had hot flashes, and I was worried. But Kat was like, listen, I went through this last year. It's perimenopause, and I started HRT, and she used this company called Winona. So I started going there to see if this was something that was going with me. Turns out it was, because I'm 46. And it's been amazing. It's taken a while to find the right dose, but once I did, it's just been huge. I've been sleeping. I feel more myself again, and the hot flashes are gone, which is, really bad. So I will tell you, it's just been so big for me. And so I wanted to partner with them on the podcast because obviously many of our listeners are going through this same age range and definitely are having these issues. And there's just no need for you to suffer. So if you go to the link that's in our Linktree, you can click on that and save money. If you go there and you meet all the criteria, and this might be something for you to try. So I just want to make sure you had this great resource because it's just been such a big difference for me and Kat. Again, you can go to the link in our Linktree and get what you need.
20 seconds a week, to lose 20% of your weight in a year with diet and exercise. That's the power of GLP-1s through Ro. Ro helps find the medication that's right for you, based on cost, availability, and your weight loss goals. Losing weight with GLP-1s is possible through Ro.
You could go either way, but I would try to be as specific as possible. AOMs is usually anti-obesity medications, and you can tell them specifically, wegovy, zepbound, right? Because if you just say semaglutide, that could fall under both, or just say tirzepatide, that could fall under both, or they might, give you potentially the wrong information. So try to be as specific as possible, and maybe corroborate that information, right? Ask the same question in 3 different ways and try to get the same answer. That way your bases are covered, right?
Yeah. I love that. Kat, I know I put a question for you.
You're fine. Yeah. So I actually have 2 questions for you. This one, I want to get this one out, but I wanted to know, like, in your practice, so it's twofold. In your practice, how important is the scale as feedback with your patients? And 2, with our actual question is like, why does PCOS go so undiagnosed? And additionally, so a lot of us are mothers in this community, and what are things to look out for in their daughters? Sneaky suspicions that maybe their daughters are dealing with PCOS. Like, say, for example, I didn't talk to my mom about this stuff. I was weird, but about like wild just periods that were just all over the place from age 12 till now. So, but what are the things to look out for as mothers, and how important is that scale?
To start with, how important is the scale?
Actually, to tell you the truth, my patients, if they do not want to get weighed, I don't require them to be weighed at all in the office. I totally respect that. And I think, I have some patients that are like, I don't want to know. I'll step onto the scale, but I don't want to know. And that's totally And there's some patients who will say, they'll run in, they'll be like, I want to get onto the scale. And there's some patients who are like, I don't want to get weighed. And I respect all of that, because there are ways that you and I can tell if the weight is potentially coming down, right? The way your clothes fit, the way your body shape is changing. There's so many other avenues, and that number can be triggering for some people, right? Or just the habit of stepping onto the scale might be triggering for some. So it's very important to have a delicate balance, and also have that conversation and be respectful to if patients don't want to step onto the scale. That's something actually where, we do some training for future doctors, and we're trying to enforce that's okay. They're patients are allowed to refuse that. And you shouldn't be appalled by that either. That's okay. There's other ways for you to get objective data, right? I think the thing is sometimes physicians, that mindset is we want data, right? We need data to tell, but there's other ways to get that data. Right. So if someone tells you, I don't know what weight I am or how much weight I lost, but my jean sizes are different, or I feel like my shirt fits different, right? Or I feel like I'm having more ease with activity, right? So there are different ways that you can kind of go about that to kind of glean some of that information. It might not be exact, right? But it's a good indicator. And that indicator might also actually make your patient feel more comfortable. Right. So maybe the person who's sitting in front of you hasn't even thought about it that way, and they're afraid. Right. And once they realize, like, oh my gosh, I did lose 2 inches off my waist. Yeah. Maybe I'm not afraid to see, to check. Maybe I'm actually curious now. That may change. Right. But I think that's again, you need to be respectful. You need to be sensitive to certain situations. Right. It can be very, very triggering for some people. I have learned about so many things from my patients. I've had patients share with me that they went to weight loss camps as kids, things that they're extremely triggered by. So I'm always very sensitive to my patients' needs, and I think others should be too. I think it's a matter of just respecting, how they want to proceed with their healthcare. And I think that's okay. Right. So that was the first question. The second question, as moms, right? So I think very understandable concern that a parent might have with their child potentially having a similar disease or disorder that they had, right? So I think the one thing that I noticed in my clinic is that people don't share this key information with their family, your family history, right?
Mhm.
It's like one of the most underrated pieces of information I find, where I'll oftentimes see a child texting their parent or calling them like, "Hey mom, what do you have?" Because I'm sitting in front of my doctor and they're asking me about family history, right? So I think it's very important to actually know what your family history is, right? And to actually, as maybe a parent, to pass along that information
Yeah.
very intentionally, right? Saying, I just want you to know I'm struggling with high cholesterol, or
Yeah.
I just want you to know I've struggled with my weight, or I just want you to know I got diagnosed with PCOS when I was 16, right? And I've been struggling with this. And I think also between a parent and child, making that conversation be normal, normalizing having a conversation about your health or disease state or whatever battle you're facing,
That's
right?
key. Yeah, that's definitely key.
Because it's not an everyday household conversation,
Yeah.
right? And that's what I find, right? So I always tell people, I'm like, make sure you pass along this information. It's super, super important, right? So pass along the information, one. Two, don't be afraid to share,
Yeah.
right? So many girls, younger females, women haven't had that conversation. Even on the other end of the spectrum, I find the same thing with menopause. But for PCOS, there is also a genetic component. So you want to make sure that you pass along that information.
Yeah. That's so
That's
interesting.
interesting. Yeah. Yeah. The more that we do this work, the more the doctors I interview, the more we learn just how crucial genetics really is.
Yeah. So I have a question. Okay.
Yeah.
So in our community, or not in our community, in the news, we hear a lot about Ozempic babies, right? And I would tell you that we have a lot of Mounjaro babies in our community. What is it that is like causing this? I mean, I think that it is a very like a common assumption. They eat less, they lose weight, you become more fertile. This is like what people think, and then people get pregnant. And so I'm curious about that because, many of us that have PCOS, like we struggle with infertility, And so I'm wondering, do we think that's just because of the hormone regulation?
So many different answers, many speculations about this, right? So one is living with overweight or obesity can reduce fertility potentially, right?
Yes.
For some individuals. So when we work on that, right, and we maybe reduce the weight, that may improve fertility.
Mhm.
Um, the other thing is sometimes with medications, you have to be careful about other medication interactions. So, for example, with Mounjaro or tirzepatide, zepbound, specifically, remember we talked about how these medications act as a class. They slow down the stomach. They delay that emptying, the gastric emptying. So that could potentially have an interaction with some medications, right? Including oral birth control. When you first start the medication, the first 4 weeks, or if you up titrate on a dose, meaning you increase the dose those first 4 weeks, you dose, that can affect your birth control. So you might need a second method, like a barrier method, right? So that's another thing that people need to keep in mind is the actual mechanism of the medication. Third thing is you might be treating other medical conditions that may be, again, reducing fertility, like polycystic ovarian syndrome, right? So there's so many different reasons why fertility can be improved. And also fourth, people might be feeling better about themselves, more confident with themselves. Maybe they're actually just enjoying their sexual life, right? Now, feeling more empowered. I hear it all the time. My marriage is better. My relationship's better. I'm more confident. Of course. So that's a very natural part of one's daily life and their health. Right?
Yeah.
Sexual health is a part of your general health, right?
Yeah.
So there are so many reasons why somebody could potentially become more fertile, right? Whether that's increase in sexual activity, or whether that's medication effect, or whether that's improvement in your fertility. So there's so many reasons, but the main thing also to keep in mind is we do not know what the effects of these medications are during pregnancy. And we don't want anyone on a weight loss medication while they're pregnant. So as soon as you find out, it's really important to stop taking the medication and let your doctor know, and probably so they can inform, a registry, because these companies for these medications do collect that information, right? And they want to, see what the potential effects are. And that's the reason they do that.
Yeah, I think that as someone that struggles with fertility, I got to where I wasn't even thinking about birth control because you know what I'm saying? I don't have another baby, but I'm just saying like I can see why somebody would just be like, well, I don't ovulate, I'm not tracking it really well, like I'm just losing weight, I'm on my journey, and then poof,
Yeah.
you know. So I think that there's all those things are definitely interesting, to consider. I wanted to open the floor to this because I feel like you mentioned something in the beginning, and we don't have to do it. I can take it out if you want me to do something. But do you want to discuss the compound thing? Because I do think that we've learned from a lot of different doctors that there's kind of some safe stuff and there's some not safe stuff. And like, you kind of need to know what to look for. So we want to like be able to empower people like in times of shortage and things to be able to like understand. If you want to talk about that, even if like you don't agree with that, I'm okay with that because I think that people need all of the information, and I think that would just be helpful if you're open to doing it.
Yeah, I mean, I'm okay with it. So I want to ask Kat actually what she thinks because I want to just make sure that you're comfortable, Kat, because my personal, actually not my professional stance really is that I tell people it's not FDA approved.
Yep.
Right. And that's because of all of the data that we have from the FDA showing that there have been severe adverse effects. There have been hospitalizations. There have been deaths. I just don't feel personally as a doctor that I could be able to carry that responsibility, not knowing myself if every batch of every medication is safe, and the same efficacy and the same clinical outcomes that we would have with the FDA approved drug. So that's what I follow. So if that's okay with you, for me to mention, then I'm okay with it. But I also know you mentioned very openly about, your use. So I don't want it to be an offense, to what you're on.
No, not at all. I mean, it's just, I would say FYI, like I do get my compound from a telehealth from a doctor. I'm monitored, but yes, there's a lot of variables to it. Yeah.
Yes, I think it's very confusing for people who are out there in the community because the FDA is saying one thing, doctors are saying one thing, even amongst doctors, people are saying different things.
Yeah.
Right.
Very confusing for people. And I think the main thing that I don't want for my patients is for people's desperation to be capitalized on. Right. Because this is a disease process that people are tired of trying and they're demotivated. And then all of a sudden on Instagram, you have summer sale special, $2.99. Right. And I'm like, oh my God, I get these. I get
over on your Instagram everywhere. Yeah.
I get
get your Semaglutide for $29. Yeah.
So
it's the peptide companies that scare the worst out of me. I mean, like we're just having open discussion about it. The peptide companies are the ones that scare me. Like where when they'll tell you don't need a prescription and like, what? Like, I mean, we have seen, like Kat and I have both been on this a long time. Like we have seen, this is very complex. Like it's not easy. And there are people where there are telehealth companies that, you just chat with your doctor, like, and you send them a message and there's not like an appointment. There are telehealth companies where, you have to have an appointment. There are telehealth companies where you're only going to meet with an obesity specialist. It's like a really big thing. And like, I've had doctors on the show too, that are they just say they leave you. They're like, I don't want to risk your life or my license. Right. Because I just don't know, like, there's just not enough. And I do think people need to hear that. I often say, like, I know me living with this disease. If I couldn't get it, I would probably go to a 503A, regulated as much as we could possible pharmacy, because I have reached a certain level of health I'm not willing to give up. And I think that many people feel that way, but I do think that there are some companies out there that are capitalizing. And I don't care as long as people know the risk versus reward. Like as long as they are aware of those things. Where I struggle is when people want to lose, when people don't have obesity, don't have like the indication for obesity, or they don't have the indication for type 2 diabetes, or they don't have the diagnosis, apologize. And then there are telehealth companies that are like, oh, you just want to not be hungry and lose 10 pounds, then okay. Yeah, and that does concern me. It really does. And I will tell you, it's not for any other reasons that it hasn't been studied. That's it. That's my only concern. Like I don't care if somebody, if it's been studied in somebody that has going through menopause and they just can't get that 10 pounds off and they have found out this will help them, hallelujah, do it. I don't mind. But I just want people to be aware that it hasn't been studied. And I think because we keep calling them weight loss medications.
True. Yeah.
Confused.
Are you ready to transform your approach to weight management? Introducing Mochi Health, a revolutionary telehealth platform connecting you with board-certified doctors and dietitians from the comfort of your home. Their holistic approach includes personalized nutrition plans and FDA-approved GLP-1 medications like Ozempic, delivered right to your door. At Mochi Health, they believe in affordable, accessible care for everyone, regardless of insurance coverage. No more blame or shame, just support from real doctors and dietitians who listen. Visit Join Mochi today to start your journey to a healthier you. Use code plussideZ with a Z to receive $40 off your first consultation. That's joinmochi.com with code plussideZ. Mochi Health, where your well-being comes first.
And I think that when people don't have the information they need, right, then they take, I'm just going to say it, stupid risk, scary risk. And so I feel like it's important for us at least to discuss, that we know that in times of shortage, this is something that's available. Yeah. We have been hearing that Eli Lilly isn't going to be reporting their shortages anymore, which means it's on the patients to report the shortage, right? And there's a whole lot of reasons for that, I'm sure. I want people to be able to get their medication because ultimately, because we call them, in my opinion, like we call them weight loss medications, right? Then people don't understand that this is actually medications for people that have a disease. It's sick people need medicine, right? Yeah. And I think that it's really difficult with this like barrier to entry with the price and then also with the availability because of shortages. So I just want people to be aware that it is a risk, but you have to decide, and please do it with a medical professional. Please don't I'm actually, there are a lot of people in our community that use a peptide company, and it makes me very scared for them. And I know like we've had Dr. Albert on our show and he was talking about like, this treatment crosses the blood-brain barrier. Like this is very serious. This isn't just taking some random peptide. This is a medication treatment. Yeah. But I would tell you, I think most people are getting it that way.
Yeah. I mean, I've had some patients who have been very sincere and just been like, they've come to me and they've said, listen, my insurance doesn't cover it. I already am on this medication and I came here. I'm like, yeah, oh my God. Right. And then it's also because they may have not found the right avenue to pursue. Yeah. If you have an obesity medicine trained doctor, we know how to treat individuals with obesity before GLP-1s came out.
Yeah.
What were we using? We were using other medications, right? Mm-hmm. We know how to use those medications and they don't cost that much.
Yeah.
So there are other options. Granted, yes, you have to be aware of the side effect profile. They may not be potentially as efficacious, right? Mm-hmm. But it's all about weighing out the total collective picture, the availability of drug, the cost of the drug, the side effects of the drug, right? All of that counts. So I'm okay with talking about it if you want. I mean, we had some discussion right now. You can take snippets or we can start again. That's totally fine. Yeah. But whatever you want, I'm totally fine with that.
In terms of like, and if you don't like know this, okay too. But in terms of like the types of pharmacies, so we hear 503A pharmacies and we hear 503B pharmacies. If you're going to do a compound, that at least they have some oversight and some regulation. And so a lot of us we've been saying to people like, just find out where you're getting the medicine from. Because there are also doctors that get it themselves and sell it in their doctor's office. There are just a lot of different ways to get the medicine. And my only, like, honestly, my biggest concern is, like you said, like you mentioned, like testing, like batch testing, and there needs to be some sort of protocols in place. But I don't think that's I don't think people even know what to ask. And I think doctors are very scared to even really talk about it for those reasons that you mentioned, which are valid reasons, Yeah.
There's just no FDA oversight there. Yeah. There's not the same clinical safety and efficacy testing that happens on compounded medications compared to FDA approved medication. It's just not the case. And I think the one thing that you have to remember is you don't want to have a long-term risk for short-term benefit, potentially. So for some people, it may be cost that, they may be saving on in the short term, but you don't want to cost an aspect of your health. People have had very serious adverse effects from compounding medications. They've had hospitalizations. People have had deaths, right? And the FDA collects this data that they find, right? The other thing that's falsely promoted is that they're generics of FDA-approved medications. They're not generics of FDA-approved medications. There's no generic of semaglutide or tirzepatide. In fact, I've even seen, medication ads. They may even be false, right? I've even seen ads for different forms of administration, right? They may not just be injectable.
Yes.
There may be other forms, right?
Lozenges. I'm like,
lozenges, right? Yes, exactly. The other thing,
little gummies that break up.
Stop.
You have you take one every other day of tirzepatide.
Yeah, we're seeing meds that also are not even on the market as being FDA approved. Yes. So I think sometimes, we also need to have a very candid conversation with our patients. We also get targeted by the same ads. I get them on my socials, right? Social media algorithms probably think I'm a patient, right? But I'm the doctor. I'm also a patient, but but I'm also getting the same ads and I'm seeing what my patients are seeing. And sometimes it's also very tactfully just placed, right? So I've had patients send me sometimes TikToks and be like, "Hey, Dr. J, look at this TikTok. It said if I administer in my thigh, it's better than my belly." And then they show this study, and I'm like, "Wait, that's not even the right drug. It's not even the same drug. So we can't use that, right?" So, and it's such a fleeting short that you really have to pause the video somehow and just word. So it's a lot of attention to detail. I think overarching safety needs to be taken into account. I think a lot of patients need to realize that this is a medication for a disease.
Yes.
Right? You need to be under the right guidance by healthcare professionals. You need to be tested. You need to have a proper history. I know some people are getting these medications without ever speaking to anybody, without ever seeing anybody. It could be a simple text message and they get it. They could just be buying it. Some people don't even need a prescription. I think you need to really realize FDA approved medication for obesity is through prescription, through a healthcare provider with proper evaluation, with proper history taking, with proper assessment, with a proper plan, and with proper follow-up. Because if you don't have a plan for follow-up or even the proper assessment, you may be on the wrong medication. You may not be on the FDA approved medication. You may have side effects and you may not know where to go. And you should always have a plan for follow-up and where to go if there's a problem.
Yeah. And I think also side effect management, right? So when we do lives on TikTok and people come in and they're like, "I'm so nauseous, I'm vomiting." And we're like, "You shouldn't be vomiting," right? You need to go talk to your doctor, right? But then there are other people that are like, "Nah, just take a Zofran, you'll be fine." No, you shouldn't be vomiting. Go talk to your doctor. You know what I mean? But they don't want to. But that goes back to those things we were talking about in the beginning too, right? Why don't they want to, right?
Exactly.
And a lot of times people will say, "Well, I don't want to tell them because then they'll take me off of it and it's the only thing that works." But you're vomiting, my friend. And we have to, we have to try to help them because there is nobody, there's just not enough people for how bad this is, And so it was just us trying to help them and be like, you need to do it,
It's a little bit of a catch-22. Some people might not have proper counseling on what they need to do to care well on the medication, and then they have side effects, and then they don't want to tell somebody because they don't want to be taken off, right? Potentially, right? Yes. So it's really about getting the proper counseling, informing yourself of the correct information on how to be on this medication safely, how to give yourself the best chances of having good results, and then proceeding with the medication therapy. I think not telling a doctor about potential side effects can be more detrimental. That's what you hear about. Yeah, absolutely. In these studies with these medications, we hear about things like from GI side effects, which may not seem to be anything harmful, right? A little bit of nausea, some vomiting, some diarrhea. Well, these all cause dehydration. And in these studies, we've seen instances of acute kidney injury. You don't want to injure your kidneys, right? Which can, again, it can be a lot worse than people think. Constipation, right, is another side effect, very underrated.
100%. Yeah.
A lot of potential problems, right?
Yes.
So, I mean, just think about being constipated for a day or two. People might go several days, and that can have a lot of health implications, right? Being constipated, right? So sometimes undervaluing certain side effects, not telling your healthcare provider may be worse in the long term. So it's really important to be forthcoming about it, but also I'll put some of that ownership on the medical care side as well, right? We should be asking patients, hey, are you having any nausea, vomiting, constipation, diarrhea? How are you doing on this medication, right? So again, having regular follow-ups with doctors is really, really important. You know,
I agree. Like, I mean, I think that, and we are talking about that a lot. And I will tell you though, there are people that are, like I said, that are on like peptides, and things like that, or maybe they do get their medicine through the way that we were just describing, that are probably not going to like this. But here's the thing, like, I have to be straight up honest. As long as people are aware and they have all the information to make this choice, I don't care what they do. I really don't. But I mean, I'm not a doctor and I don't have a license to lose, right? So, but for me, if you want to go into a peptide company, I don't care, but you need to know that you don't know where they're coming from, right? And if you're okay with that, then you're okay with that. Hallelujah. And I'm fine for you. Like, you do what you want, you know? But I think that most people don't know. They think it's just like everything else. You know?
I am always surprised. I actually pull up a couple of different things when patients come in and ask me about compounding, right? Yeah. And one thing that I pull up is the FDA warnings that came out last year, right? So there was a statement that was issued. Second thing I pull up is Novo Nordisk's warning about compounded semaglutide. They actually say that they do not provide semaglutide for compounding purposes to these other agencies, pharmacies. They're not sure where it's coming from. That, you know, they can be falsely advertised. They can be not the real substance. There can be impurities. They've come out with an update to this statement with updates regarding that. And, you know, the FDA reports that they've heard with compounding agents. The third thing which recently came out was also Lilly's statement about compounded tirzepatide. And it's getting a little bit trickier, to be honest, besides the false advertising and the other agents, which, you know, are not FDA approved, with patients not being able to tell the difference, right? That I've been seeing since the beginning. Some patients think they're on the FDA approved medication and they're not. Right. So they'll come into the office and they'll say, yeah, I'm taking
I'm on the generic
X, Y, and Z, and I'm on the generic, and that's FDA approved. And I'm like, nope, not FDA approved, not the generic, not the real drug, right? So rather than real drug, I should say the FDA approved version of the drug.
I mean, and we had a compound pharmacist on the show once, and we brought on some obesity doctors, and we talked about that there's gray areas, right? Like, there just is. And we talked about what a big problem this is. And, you know, and we talked about the fact that it does oftentimes like come from overseas and all of those different things. And again, as long as you know, I don't mind. Like, just our listeners, as long as you know, I'm okay with it. I really am. But I just think that people are being led astray. Like, I mean, I'll just be straight up honest with you. My mom came to me and was like, hey, like, there's this weight loss clinic down the way and I can pay him $700 and get some semaglutide. I'm like, don't you dare. Don't you dare do that. And it's not for any other reason except for one, what are you doing paying $700? No. And she said, and it's this program and it's this many weeks. And I'm like, no, and my mom is just barely on that line of having obesity. And I was like, no. And so I got her with an obesity specialist who did all the things and got it approved so that she could get it for a couple $100 a month. And it's the FDA approved. And like, people think it's not possible. And I think a lot of that is because they're going to doctors that don't know how to do the PA right, you know, or they're, it's also a big problem with insurance. Like, insurance is making it freaking impossible. Like, at the end of the day, but that's what I'm saying. Like, to be clear, I am no better than any of these people. If tomorrow I couldn't get my medicine, I'm going to go to where I think that I know best. But unfortunately, like that is being put on the patient to figure out what equals safe or not. And I think that's difficult. So I will, and on the other side of the coin, of course, Eli Lilly doesn't want us getting compound. Of course, Novo Nordisk doesn't want us getting compound. They want us to buy theirs. And if they had theirs and it was on insurance formulas, we would all be dancing and enjoy, like everybody would be happy. But it's not. And they charge a lot of money. There are consequences for those actions, right? Yeah. And you're not making enough. And there's consequences for those actions. Unfortunately, we're the ones that have to pay the consequences, right? The people who have the disease. So I think that it's just important for people to know what's what. And they can pick whatever they want. I try to bring resources, to the plus sides as much as possible, to things that I think are okay, but it's still just my opinion, So I try to have more than one so people can choose what's best for them. Like I have some doctors that will suggest, like Dr. Albert's a great example. He won't prescribe compound.
He won't, no.
But he is an excellent doctor and he will work very hard as team to try to get your PA approved. He really will. He'll go the extra mile and he knows how to do it, and that doesn't mean he's going to every time because it's getting harder and harder, but, just things like that. I appreciate you having this open dialogue about it because it is, especially things like with the lozenges, especially things with people saying that triple G, like that one is available. People are taking that. No, you're not. Like, first of all, you're probably not. Like, they're probably lying to you. Like, you're probably taking semaglutide. They're charging you $500 or $700, $800, whatever dollars a month and pretending like it's the newest, hottest thing that's still in long-term studies, like for the next couple of years. And but people don't know that. They're like, oh, I can get it now. It's fine. It's not FDA approved anyway. No, it's still in studies. It's not approved for anything, but they don't know those things. So we're trying to bring that here. So I appreciate the open dialogue, but I really do.
Yeah, of course. Yeah. I think the main thing is, as a doctor, it's not that I haven't, been on a journey with the patient for their health with maybe decisions that I don't professionally, maybe or personally agree with or advise, right? Because you have to understand that it's it's dual decision making. It's together, right? That you're deciding something, or it's really, whatever the patient wishes, right? So as long as they understand the risk and the benefit, I can present the facts. And the decision then is up to you, right? Yes. And then there's what I can do from my end, right? And then we come to a consensus and that's what we do, right?
Absolutely.
So yeah, I think that's okay. And these are all respectful things, but I think the common ground, which we all share is we just want honest information that's correct and validated going out to patients so they can make a informed decision about their health, right? Because the last thing you want is to get inaccurate information, false information, and then suffer a risk or a complication of something which you didn't intend to happen, right? And sometimes that can happen either way, FDA-approved medication, non-FDA approved medication. But our goal is to really create the best case scenario where the patient is given the correct information with all the risks and benefits known so they can make an informed decision.
Yes, absolutely. I think that's great. Yeah. I haven't had a lot of doctors that, I've only had a few that have been like, we should talk about the bad side of this. And I'm like, we really should. We really should, So I just thank you. Thank you.
Oh,
this has been a lovely discussion. This has been lovely. I think people will get really good information out of it so that they will be able to ask the right questions to their provider, and that's what's important so that they know what to ask and then they can work together on putting a plan together. So I really appreciate it. Thank you.
Yeah. Well, Kim and Kat, you're a superstar duo. I really appreciate your podcast. I appreciate the passion that you guys have for getting the right information out there.
Yeah.
I was telling Kim earlier, I'm so happy and proud whenever my patients are, learning information successful in their own ways, but also pass that on to other people and really disseminate that information that's accurate, evidence-based. And I really, really appreciate that about you guys, getting the right people in the right place with cool conversations that are a little bit, less formal and more informative. So I think that's, I think your listeners, your viewers are very lucky.
Thank you.
Oh, thank you.
We're definitely also trying to bridge the gap. And I think that, we're trying to have some, general doctors on, nurse practitioners and everything to talk about it, because I also think that I'm hoping that doctors that, other doctors will hear this, right? And go, maybe it wouldn't kill me. When someone comes to my office to go, can we discuss your weight? I actually, for the first time, and I've had obesity forever, had somebody ask me that when my lap band slipped and I had to go get it taken out. And it was a bariatric surgeon's office, and I got on the scale, and because I've been losing, we need to see where things were, I got on the scale and I saw that I had lost another 5 pounds, and I went, oh, and she goes, is that good? Because she wanted to know what good equaled to me. Right. Mm-hmm. And I was like, what just happened? Like, did you just care about how I felt and what I thought about my weight? Yeah. And it was very powerful. And I just thought, wouldn't it be great just to be like, it literally just puts people in a better place to receive the information. And I think if we did that with everything in life, where we just led with a little bit of empathy, and just a little bit of grace, that it could go a long way, Yeah. I mean, I'm no different. I should do it too. I'm trying, but I think that in general, it would definitely help with this particular problem in medicine, So
absolutely.
I appreciate it very much. Thank you so much for coming. And we will, Kat and I'll do our exits, and you'll just leave it. It'll go. You can leave. We can talk behind your back.
Oh, Dr. J, do you have a telehealth practice? Or are you just like?
No, I'm actually right now just at NYU.
Oh, okay. Yeah, you are. Okay.
Yeah.
Oh, so
find her in NYU.
Dr. Simi Lee?
Simi Lee, I don't know.
Cardiologist? No, okay. She's been on our show. She's great.
Okay. Yeah. I mean, there's so many of us at NYU.
Yeah. Of course.
Yeah. There's too many boroughs, too many, people. But I think it's pretty much going to be the end. But, you guys let me know. And then socials, you guys need my socials, or you guys have them?
Can you, if you just want to send them to me, and whatever, and I'll just paste them right in. And any other links you want, anything. Okay. And I will, if it's okay, going to put your talk on the Obesity Coalition.
Yeah. And there's actually a really, there's a Rolling Stone article, actually, when they had a push. I was like, Rolling Stone's writing about this very early on. They were very ahead of the game with compounding, and they actually came out with a very, very good article, which has a very interesting title. It's very kick-ass.
Awesome. We'll put that in.
Yes. Now I need to go find it.
Yeah, you gotta just Google my name and write Rolling Stone FDA warns, and then you'll see what I'm talking about.
But, okay, those are some good terms.
Yeah, exactly. But there are a lot of good articles out.
Thank you.
All right, guys. Well, it's been a pleasure.
Thank you, Dr. J.
Thank you so much. Thank you, Dr. J.
Have a good night.
All right. Good night.
Bye.
Love it. Oh my gosh, I'm so thirsty. That was great. She's fantastic.
Yes.
She's fantastic. As soon as I saw her talk, I was like, this girl.
Yeah. Hey, Dr. J.
She's great. Actually, the PCOS drops. Oh my gosh. We need that. We've been looking for that.
Yes.
We needed that. Yeah. I think it was a good discussion. I think we need to have it. I'm seeing more and more things. I don't know if you're seeing it on socials, where these companies are being like, it's getting fast and loose. People need information. You know what I mean? And we just got to talk about it. I just feel like it's necessary. And because you and I both, we've talked about it. Like, if I can't get my medicine, I'm doing it.
Yeah.
Point blank, period.
I feel safe,
Yeah. Well, I think you and I both agree, especially the place that you're at. I feel very safe.
Yeah.
Yeah. But ultimately, we know all of this is a risk, right? So, but it's about making an informed choice. And I think people knowing it's important. And I can't be taking these people coming around telling people to suck on semaglutide. I can't take it anymore. Please do not suck on semaglutide. Don't do it.
Sucker. What? Oh my gosh. Yeah.
Yes. But it's true. People don't know any better, then it's not their fault. It's because the information doesn't exist. So we got to talk about it. We say hard things here and we talk about hard things. So I think it's good.
Yeah, we sure do.
Yeah.
We sure do, my friend.
We do. People don't always like it. We don't always have fans. This week.
The elephant in the room.
Yeah. All right. We're going to keep it professional. Hasta la pasta. We'll see you next week.
All right. Hasta la pasta.
Bye. Let me tell you a quick story. I was telling Kat how I was regaining weight after my 100-pound loss using GLP-1 medications, and I was having snacky cravings and waking up at 3 a.m., and I had hot flashes, and I was worried. But Kat was like, listen, I went through this last year. It's perimenopause, and I started HRT, and she used this company called Winona. So I started going there to see if this was something that was going with me. Turns out it was, because I'm 46. And it's been amazing. It's taken a while to find the right dose, but once I did, it's just been huge. I've been sleeping. I feel more myself again. And the hot flashes are gone, which is, geez, really bad. So I will tell you, it's just been so big for me. And so I wanted to partner with them on the podcast because obviously many of our listeners are going through this same age range and definitely are having these issues. And there's just no need for you to suffer. So if you go to the link that's in our Linktree, you can click on that and save money. If you go there and you meet all the criteria, and this might be something for you to try. So I just want to make sure you had this great resource because it's just been such a big difference for me and Kat. Again, you can go to the link in our Linktree and get what you need. Today's episode is brought to you by Ro, a telehealth platform that's changing the game of GLP-1 access. What sets Ro apart? Ro understands the challenges of navigating insurance hurdles and the skyrocketing prices of GLP-1 medications. That's why they specialize in getting insurance approvals for GLP-1s. And if insurance is a barrier, they go a step further by prescribing brand name zepbound vials for prices close to those of compound GLP-1s. With Ro, you're not just getting a prescription, you're getting a partner in your journey that's helping you access affordable treatment and guiding you every step of the way. Whether it's insurance approvals or cost-effective alternatives, Ro is here to make sure that you get the medication you need. Visit ro.co/plussideZ with a Z today to see how they can help you take control of your weight management journey with affordable, accessible care. That's ro.co/plussideZ with a Z, making healthcare work for you. Check out the link in our show notes for more details.
Are you interested in understanding GLP-1 medications like Ozempic, Wegovy, or Mounjaro? Then join us on the Plus Sides Cracking the Obesity Code, the groundbreaking podcast helping people change their lives one episode at a time. The Plus Sides podcast is a disruptor. We're breaking down barriers, smashing stereotypes, and sharing inspiring stories that'll leave you feeling informed and empowered. Join us every week to learn from doctors who are specialists around GLP-1 medications like Ozempic, Wegovy, and Mounjaro. They'll provide you with science and facts to validate these incredible stories. But that's not all. We'll also bring you the voices of the GLP-1 Mounjaro TikTok community, real people who face the challenges of obesity-related diseases and disorders and discovered the incredible plus sides of GLP-1 medications. Our episodes are filled with heartwarming stories, laughter, and moments of triumph. You'll connect with our amazing community members who are reclaiming their health and experiencing their fullest lives. Are you ready to embark on a journey of discovery and empowerment? Tune in to the Plus Sides Cracking the Obesity Code, and together we'll change the narrative around obesity and end the stigma. Subscribe now on YouTube or your favorite podcast platform and join our incredible community. Let's celebrate the plus sides of life together because every story deserves to be heard. Every life deserves to shine, and everyone deserves access to expert knowledge and medication. The Plus Sides Podcast. You're not alone. It's not your fault.